Ahlan wa sahlan, khosh amadid, and good afternoon, everyone. Welcome to the first in-person She Teatime since the pandemic started to celebrate the International Women's Day. This year's theme is Changing Climates, Equality Today for a Sustainable Tomorrow. A theme recognizing the contribution of women and young girls around the world who are working to change the climate for gender equality and sustainable future. My name is Navid Madani. I'm a mother, I'm a scientist, I'm a patient at Dana-Farber Cancer Institute, and I'm the founding director of Science Health Education, the She Center. The center was established to specifically promote scientific and health collaboration and partnership around the globe. The goal of the center is to promote research collaboration, scientific training, and capacity building in a two-way dialogue, what we can learn from the rest of the world and what we can teach globally. This is with a focus in the Middle East and North Africa, and also through partnership with Harvard Medical School community. Dana-Farber Cancer Institute, established in 1947 in Boston, has been a vanguard of many discoveries in cancer and retroviral research and has a history of passionate clinical care and treatment. Similarly, the King Hussein Cancer Center and Foundation is an independent, non-government, non-profit national foundation founded in 2001 by royal decree. Both institutions are dedicated to saving lives with comprehensive cancer care and treatment, advocacy, and involvement of general public in fighting cancer. I am honored to say that both institutions are led by strong women, Professor Lori Glimcher of Dana-Farber Cancer Institute and Her Royal Highness Princess Ghida Talal of King Hussein Cancer Foundation. As I sit here today, I'm truly honored by our guest on International Women's Day. I can't help but think about the effects that cancers such as breast, ovarian, and other cancer have had on women globally. Yet there's also incredible strides women have taken and are currently taking toward the fight against these deadly diseases. One of these women is our honorable guest today, Princess Ghida. Thank you so much for being here with us on our first in-person She Teatime. I'm going to quickly give everybody a background on your life. Princess Ghida is a graduate of Georgetown University. In October of 2001, His Majesty King Abdullah II appointed her as chairperson of King Hussein Cancer Center and Foundation. As the wife of a cancer survivor, Princess Ghida devoted herself to fight against cancer and the tireless fundraiser advocate for the center. I thank you for that. Princess Ghida joined the board of the Institute of International Education, IIE, the Scholar Rescue Fund in 2007, organization that is close to my heart as well, and IIE's board in October of 2013. She played a role in launching the Iraq Scholar Rescue Project that rescues persecuted scholars from Iraq. This earned her IIE's Humanitarian Award for International Cooperation in 2008. In 2011 and 2018, Princess Ghida represented Jordan at the United Nations by addressing the United Nations General Assembly's high-level meeting in non-communicable diseases. In addition to all of her work, Princess Ghida is a mother of three. That's wonderful. Thank you again for being our guest today. So I am going to start by, first of all, congratulating you on this wonderful leadership you have at King Hussein Cancer Center and Foundation. You just celebrated a 20-year anniversary of the foundation and the center. What has this meant to you to lead this institution?
First of all, I'm thrilled to welcome you to Jordan. I have been wanting to meet the formidable founder of the She Center at Dana-Farber, and it is truly a pleasure, and I hope that we will find many areas where we can continue our cooperation. Inshallah. I have to say, I cannot mention the King Hussein Cancer Center without recognizing King Abdullah and Queen Rania, who have been our strongest supporters from day one. They've been with me at every stage of the establishment of the center and have helped us overcome many challenges. Now, establishing the King Hussein Cancer Center and turning it into a center of excellence has been my life's mission. With, of course, being the devoted mother to 3 children. Now, as you mentioned, I am the wife of a cancer survivor. So I know firsthand the toll, the trauma, the distress that accompanies a cancer diagnosis and the journey of cancer. And at the time, when my husband was diagnosed 30 years ago, we were privileged to be able to travel abroad and get treated at one of the best hospitals in the United States. And this was not the case in our part of the world. There were literally no cancer centers to speak of. And how could I stand still and watch thousands of Arab patients receiving not adequate treatment? You know that in the world of cancer, unless you get the best treatment available, you might as well not get any treatment. So this, of course, led me to establish the King Hussein Cancer Center. And so with an incredible team of men and women, doctors, physicians, medical corps, we set about establishing the King Hussein Cancer Center, and we assembled a great medical team and started forging international partnerships with the leading centers in the world. And this is how the King Hussein was born, and it now addresses the cancer needs of the entire region. It is the only standalone comprehensive cancer center in the entire region, and it addresses the needs in terms of treatment, in terms of research, and in terms of refugee help. Because we have over 1 million refugees in Jordan, from Syria, from Yemen, from Iraq. So these refugees also get cancer, and they come and get treated at the King Hussein Cancer Center. So all these factors, in summary, I would like to say that KHCC has become the cornerstone for cancer care in the entire region, cancer center care of excellence at par with international standards.
Absolutely. This is wonderful. As you were speaking, I really had goosebumps thinking about what you have done in the past 20 years, because you're right, 30 years ago, many people, we didn't have anything, and many people had to immigrate to other places in Western world mostly. Just recently, I wrote our annual report, and I wrote the letter from the founder, and I said, you know, from the time I started at Dana-Farber, every time I went through the double doors of Dana-Farber, I was hoping that I could translate some of everything that is going on within Dana-Farber to my region. And you are doing that through King Hussein Cancer Center.
You know, Navid, I can't tell you, I used to spend so much time thinking when I was with my husband in the US about the women in our part of the world, mothers or wives or daughters of cancer patients. And I used to think, what's the difference between me and them? I mean, literally in those days, only the privileged few had access to travel abroad. And, you know, sometimes to this day, when I walked into the King Hussein Cancer Center, that receives sometimes 250,000 visits a year, and I started thinking, where would they be?
Where would they be?
Where would they be?
Exactly.
You know, many of them would, I mean, most of them would not be with us.
Right, absolutely. So. And also you mentioned refugees. Because of the conflicts in our region, cancer is going up. You know, the stresses, the pressures that are on all of us. Cancers are going up among women, among children, you know, and so access to treatment becomes even more critical. Speaking of access to treatment and population in general, Jordan has one of the youngest populations, similar to the rest of our region. 63% of population is under the age of 30. And at this large population, that youth is growing older, we have two kind of avenues. How we can use this human capital in our advantage for advancing health and prosperity, and how can we get them involved? What do you see as the greatest strength offered by this youth population, especially young women?
I think when we talk about youth, I believe that it is imperative to start by listening to them, listening to them, listening to their concerns, in order to be able to earn their trust, first of all, and then address their needs. If we don't go through these steps, I don't feel it helps at all to impose or to bully opinions upon them. So what you said is absolutely right. I think as much as we can, because it's a commodity that's becoming very rare in our part of the world, I think it is important to stress on their humanitarian core. I mean, I always tell my children that you can have all the riches in the world. If you don't have humanity, you have nothing. I truly believe that humanity is the basis for everything, for happiness, for serenity. So one is that. On the other hand, I am encouraged that youth these days, and especially our women, are becoming much more, first of all, they are much stronger. They are much more ambitious. They are much more aware of their rights and the need to assert these rights. And so as a result, we see that these young women are no longer, or at least much, much less, intimidated by patriarchal biases and reactions. And I think this is very encouraging. And to also set an example. Now, I've tried to do this at the King Hussein Cancer Center and Foundation. The foundation, for example, the 90% of the workforce is female. And including the director and the heads of departments. At the cancer center, which is the hospital, nearly half and 47% of the workforce is women. With 47 women also being full-time scientists and researchers. So we are always continually trying to break all the taboos in that respect, in order, again, to encourage the youth, because it is by example. So this is what we have done, and just I think to just keep on. It could sound like a cliche, but it is the truth. Is constantly communicating with our youth and engaging them, and believing in them and telling them that we believe in them, that they can effect change instead of just telling them what to do and acting self-righteous.
Absolutely. No, it was such a breath of fresh air to come to Amman Airport last night. And when we were getting the PCR test, I'd say 99% of people who were helping us do the PCR test were women. And young women too, very young, extremely professional. So it was amazing. You talk about engaging the youth. So you play a mentor, obviously, to a lot of young people, and I've seen it interacting with your staff. Who were your mentors? Mentors that you worked with directly, or mentors that you never met, but they were some people that were outside, but you looked up to them?
Without a doubt, my number one mentor, role model, guide is my mother. She continues to counsel me on matters small and big, and from a very young age, she taught me to rely on my conscience and my convictions, and not to be intimidated by the trending viewpoints in society. My mother was different. She was nonconformist. She was very independent. And she also nurtured my sense of confidence and not just confidence, but like I said, independence. For example, when I graduated from Georgetown, she encouraged me very much. I was a young reporter. I was just starting. She encouraged me to go and live in South America, which was an area totally foreign to me, in order to be completely exposed and be totally out of my comfort zone. So my mother did that as well for me, and I'm always in admiration of her values of loyalty, integrity, and honesty. Another person who I was so fortunate to work with and know closely was King Hussein. And King Hussein, besides being a legendary leader, he was a true humanitarian. He always encouraged me to include compassion in every action and choice. He was the same in private and in public. He spoke to kings and presidents in exactly the same way as he spoke to a junior member of staff. Probably the most humble man I've ever met. And this helped me a lot in my life, because he always stressed that privilege comes with responsibility. And titles, positions really mean nothing unless they are earned. And of course, I'm sure you would agree with me that truly my overall role models have been the countless cancer patients that I have met. I spent a lot of time at the King Hussein Cancer Center, and I spent a lot of time with cancer patients, and they really have taught me the meanings of perseverance, dignity, courage, and also, Navid, you know, they really teach you to rearrange your priorities totally, and you feel embarrassed, even ashamed, from wasting any time on the trivial matters that everyone is upset on. And I can remind you that you can never ever take your health for granted.
No, absolutely. These are wonderful. I have read about King Hussein. These are wonderful mentors. I have read about King Hussein, God bless his soul. And his humanity was truly out of this world.
It was really above all else.
Right. And you see that in the kingdom. You see that in, day-to-day people too. Jordanians in general, I think, would like to emulate him. So I'm going to transition to, the work of the She Center in general. We like to establish global collaboration and global mentorship and a two-way dialogue. Where do you see how critical the roles of the She Center be in, inshallah, our future collaboration, if we see a path to collaborate together?
Thank you. Again, I am thrilled to meet you today, and I know that it is the beginning of many good and happy years of collaboration between us, all towards the welfare of people and cancer patients. The way I see us, first of all, I see us collaborating in on many dimensions. But if I want to think about what comes directly to my mind, I think we could collaborate, for example, on taboos and stigmas and breaking the taboos. They do much, much more harm than we think, these taboos, because first of all, they cost us lives. Women especially are often in denial of having cancer. And many women, we unfortunately have found, not many, but some women are still to this day afraid to reveal that they have cancer because their husband might divorce them. This is still happening. So on another side as well, the taboos about cancer in itself. You know, we have to keep reminding patients, as if it's not stressful enough to have cancer.
Right.
You have to also worry and feel sometimes ashamed
Right.
that you have cancer. You know, it is an illness like any other, and we really have to educate people. And I really think this is something that we could help. Even in the United States, you still find sometimes areas where you do get stigmatized. I'm not sure about the workforce, but you could get still stigmatized. Another area that is very dear to me personally, and that I have insisted on at the King Hussein Cancer Center, is mental health. I feel so strongly about mental health. I believe, like so many do, that there is no health without mental health. So in this part for us, again, with regards to cancer, but it does not have to be only cancer, but with regards to cancer, like I said, it is stressful enough to have a cancer diagnosis. I mean, I think 90% of cancer patients are going to need mental support. I mean, you're suddenly facing the possibility of life and death. How do you deal with that? So basically, here at KHCC, we have established a network of psychiatrists and therapists where they are totally integral to the treatment plan of the patient. And personally, I think you can never do enough. I think millions around the world are suffering in silence. And we still get so much misdiagnosis. And even with the misdiagnosis, you suffer in silence because you don't want to say anything. So this is another area. A third area, which is a much more hopeful area, not hopeful, but one where hope has already had its impact, is early detection and awareness. Because I'll tell you our story. When we started, 75% of our women were coming to get diagnosed for breast cancer at the late stages of their disease. So most of them were dying unnecessarily for no reason. We established the Jordan Breast Cancer Program. And because of it, we were able, nationwide, of course, we were able to flip the statistics. And now 35% of women come at the late stages. And of course, we will not rest until 0 women come at the late stages. But I think this is also an area that we could, cooperate with. I just want to give you an example of how important partnerships are. Not that you need to be convinced, but we have literally built the center on partnerships. Of course, the strong traditional partnerships with MD Anderson, with St. Jude, with various cancer centers, but and we've also built partnerships regionally. So in the region, the strongest medical center is in Lebanon, the American University of Beirut, and with Lebanon in general. Now, as you know, Lebanon has descended into chaos for the last 2 years, and for the last year, there has been no cancer medications have disappeared from the suppliers and the pharmacies. So basically, cancer patients in Lebanon didn't have anywhere to turn to. We came to the rescue, and we have now for a whole year been supplying the cancer needs of 7 hospitals in Lebanon. And this is all a result of partnerships. So it's limitless. You know, we are ready to, we would love to hear your views.
Yeah, no, absolutely. This is something, this is something that we have definitely built the She Center on. Is the partnership, is collaboration, both on a scientific level and health level. And you said it right. You know, you talked about, Syria, refugees, Syria, Iraq, and now because of the economic situation in Jordan, in Lebanon, you have to include Lebanon.
And there is Palestine, there is Libya, there is Sudan, and there is Yemen. All of them are here. So you can imagine.
Jordan is taking a lot on its shoulder, very much so. You talked about your mother.
Yeah.
And you talked about also, for the other question, you talked about how, we have to get more women come, to get diagnosed, especially with breast cancer, something that at the earliest stages is completely treatable and curable. And the most common cancer. So these two, your mother being your mentor and your hero, and getting women to come on, to the table, talks about empowerment and engagement of women. I always say that as a Middle Eastern woman, I always say that Middle Eastern women are very much empowered. The view that sometimes the Western society has through the media is the wrong view in my experience. I grew up with very strong grandmothers and mother, and I know a lot of us have, So Middle Eastern women are very much empowered, but we need to engage them. We need to get them to come to the table, and it starts with, breast cancer detection, health, decreasing the stigma, and it starts with education. Frankly, they know it, but they have to be not scared of it. One of the things that we are planning, or we're hoping we can implement, is specifically with regards to breast cancer detection, is to engage young women to be able to talk about breast cancer and do self-examination, because that, to me, it's a little bit of a taboo in the region to do self-examination. But however, if younger women understand it and then teach, their aunts and mothers and grandmothers, it would decrease the stigma a little bit. So what do you think about this empowerment engagement of women in the region that would translate into better health, let's say?
Navid, I think your point absolutely is of empowerment is, of course, important and obvious, necessary. But what I think happens, especially in our part of the world, is that women always place themselves at the bottom of the ladder of priorities. You see, they will take care of the husband, they will take care of the mother-in-law, they will take care of the children, they will take care of the aunts, they will take care of everybody, and leave themselves last. So it's a mixture. One is in very, very traditional, they're worried that they might get divorced, so they don't say anything. But on the whole, through all the strata, they literally leave themselves to the end. So what we have tried in our campaigns, because from the very beginning, the way we have approached breast cancer is very, very different from the pink ribbons and we really wanted to go much beyond that, and of course not to be only the month of October. So this is what we have said. We have reinforced the message to women everywhere: make yourself the priority. Because as you know, without the woman, it's not just her life that gets lost. It's the life of the entire household. Nobody can function without the woman. So imagine if you multiply that, the community is crippled. So we said, I think that we have to do anything, any idea that comes to mind to empower the woman. First of all, tell her that she is the priority. How? We go all over the kingdom. We have workshops everywhere. We speak. If I meet somebody walking in the center, I tell them. So that one. Second of all, something else that we did, we actually engaged the men. And one of our biggest campaigns was, remind her to get her mammogram, remind her to do this. And so once the man found himself as part of the project, he didn't, he didn't feel that he was on the other side of the fence. And I mean, this is what I think we need to do. And of course, just keep on reinforcing the message. Don't wait until you get that lump. I have to say that so many women get mammograms now. You spoke about the self-breast exam. You're right. We do that, in all our tours in the countryside and in the capital. We do that. Of course, we include, but we want to go even beyond that. We really want to go to the mammogram.
Right.
We really want the mammogram because with the self-breast, it's just always easy. But the self-breast is included in everything that we do.
Yeah. That's wonderful. So you want to increase the number of people coming to get mammograms per se.
Yes.
Yeah. And mammography, just like in the United States, it starts at the age of 40 here yearly.
Yes,
okay.
Absolutely. We do it 40 every year. Yeah. Absolutely. Yeah. Having said that, like I said, we call it الفحص السريري, the self-exam, the self-breast exam is there and is urged. Right. But we make sure once they hit 40 that they come for early detection. We have so many things. It costs very little. Right. We have many promotions. Anything for them.
And you're right. October is breast cancer month, but I think every day, just like I say, every day is International Women's Day. And every day should be Health Day. You should be engaged with your body, in tune in your body. And you mentioned another thing that's so wonderful to hear is bringing men into the table too,
it's
engaging.
Very important.
It's extremely
important.
You should do that
too.
Yeah.
Men when they feel like this is none of your business, get out of here.
Yeah.
They start being contrarian.
Yeah.
But if they feel that you're appealing to them to be part of this great project that's gonna save
and
their
raising
family.
sons as mothers, raising sons that will become.
Also,
again as women, we have so many responsibilities, but we have so many opportunities to change. And speaking of that,
because sorry for the man, it's not just his wife.
Oh yeah,
it's his mother,
daughters,
it's his sister, it's his daughter.
Yeah. Right.
So he has a lot at stake.
Right. Yeah. What gives you hope for the future?
Hope is a very important word.
Yeah.
Without hope, we can't live, right?
Right.
So by nature, I am somebody who is extremely optimistic, extremely hopeful. And I will quote again His Majesty King Hussein. He always said there's always a solution for everything. Everything will turn out well. There is a solution. So I literally include hope in everything, let alone in a cancer center.
Yeah.
You can just imagine a cancer center without hope.
Yeah.
This is why from every aspect, physical and mental, when we designed the center, my number one priority, and you might have noticed it, is that it's full of light.
Yeah.
It was very important for me that when you come into the doors, you are in an uplifting place and spirit. So hope is included everywhere. We're not here. We're here we have the disease. We're going to treat it. This is what we're going to do. We're going to take care of you, and inshallah, you are going to be fine. We don't like to waste much time. Not well. Those who are, of course, clinically depressed or everything. That's why I said there is the mental health factor. So, hope needs to be included all the time. We can allow ourselves period of downs, but I think after a certain amount of time, we should close that box and come back hopeful. With regards to us in particular, to KHCC, I think 3 areas I see a lot of hope in. One is research. Without research, we were talking about it, you and I. Without research, where will cancer go? So we have been very dedicated to research in the last 10 years. Before that, we were concentrating on treatment and making sure that we were getting the most advanced treatment. We just launched the King Hussein Award for Cancer Research, and we just had our first anniversary. We assembled many scientists from the region and from the United States and they were recognized, as well as, you know, they showed their proposals, and now there is a network. There are networks. So this is something annual to encourage research. Another area that I always talk about is, like I said, mental health.
Mental health.
I think that gives me hope, because every time I ask, you know, how many of the patients come to you, and you know, a lot of our patients are patients who are not used to dealing with therapists and psychiatrists, and they are searching. I mean, they are going for help. So I'm reassured to hear that. And like I said, what gives me a lot of hope is the awareness and early detection. It's really increasing greatly. You know, the word cancer was not used. You would say that other disease.
Yes.
You know.
Yeah. You would hide it.
There was a center here that did not even have the word cancer on it. I mean, and so many times until today, I get people who say, "We love your center, but please, can you remove? Can you just call it King Hussein Center?" And I said, "No, because it's an illness like any other illness, and we're going to help you overcome it." You know? So these are the things that give me hope.
You actually touched on what, you know, I was going to ask next is, you know, what do you think our audiences take away and next step be both regionally and globally? And I think you touched on all of it.
I think I will as a message. I think I will just say that everything we do, everything you do, is really for the benefit, for the well-being and the health of the patient, of women, and making sure they are healthy and safe. And I mean, if I were to say anything to members who are listening, I would say, you know, don't take your health for granted. Please don't take your health for granted. Two, I would say, keep breaking the taboos and the stigmas. I would say promote awareness and mobilize resources to combat cancer, especially also by using the myriad tools of social media that we have available to us now. Encourage early detection and prevention, of course. And I would also keep reminding the cancer patients that they're not alone, that we are standing by them.
We're a team.
We're a team, and we will do everything in our power to make sure they go into remission and hopefully they get cured. It is a horrible feeling to feel that you are alone, and they truly are not alone. But we have to keep reinforcing that message, and that cancer can be overcome. Cancer can be beaten.
Defeat cancer. That's our motto.
Especially if it's detected early.
Absolutely. Decreasing, you know, there are two of the diseases that unfortunately have a lot of stigma is cancer and mental disease. Both have so much stigma associated with them, and just like heart disease, for example, mental disease is a disease of an organ. It's a disease of the brain, you know, especially when you have, you have a devastating disease like cancer. As you beautifully have put it, mental health becomes so much more critical as well. So and the two of them go together.
Also with your ability to overcome it.
Absolutely.
You know that. I mean, if someone is totally devastated, it's not going to help. But you know, I would even say that mental health has many more stigmas and taboos than cancer. Because at least with cancer, you know, they see the cancer patient and, you know, he's lost his hair or whatever, he's very thin. So you say, oh, you know, he has cancer, I feel terrible for him. But with mental illness, as you know, you can't see it.
You can't see it.
And that's why I said that the people are suffering in silence. And I really, really wish we could collaborate on something. And it, as you said, and it has a complete impact on cancer. So, that's...
No, so at Dana-Farber, one of the things that as a patient I've noticed, I mean, first of all, you and I talked about it, my journey during cancer has opened up such huge areas for me because, while I was a scientist at Dana-Farber, science and research was, all I had. I was a lab rat. I always tell people very much tunnel vision. But now in the clinical part of it, I see what Dana-Farber offers, and it's just amazing because my team, I have my oncologist, I have nurses, and I have a psychiatrist, and I have a palliative care. So all these people are helping me how to manage my medicine, what to do, and of course my surgeon. So it's a team of medical clinicians who are helping, one patient, be able to defeat cancer.
And they have to have extra bedtime manners. Right.
Absolutely.
Really, I mean, you're so vulnerable. Yeah. I mean, I remember when we were battling cancer, we looked at the doctor, just because one word that he would say could destroy our lives.
Oh, yeah.
Or give us hope.
Or give us hope.
So basically there's a big responsibility, I think, with the caregiver. And this is something we've really tried to establish at the center. And thank God, because of the culture, people in general tend to treat everyone as a family. But I have noticed that when people thank me for an experience at the center, like one of the number one on the list is the kindness of the personnel. Personnel,
yes. That's so important. Yeah. That's so important. Yeah, the compassion, the empathy. Well, this has been an amazing time. Thank you so much. We have a tradition with our tea time that we usually finish the conversation by quotations. Okay. And today I couldn't just do one quotation. We decided to use two. One is specifically from another champion like yourself, Princess Ghida. This one is from Serena Williams, who says, "The success of every woman should be the inspiration for another. We should raise each other up, make sure you're very courageous, be strong, be extremely kind, and above all, be humble." And that's what you have shown us. Thank you. And the other one is from Professor Paul Farmer, who's a giant in global health. And unfortunately, we extremely unexpectedly lost him last month. He says, with rare exceptions, all of your most important achievements on this planet will come from working with others in a world partnership. So today we have talked about partnership, and we have talked about being kind and raising each other up. And those both quotations are what the She Center focuses on, and the reason for this trip to Amman, Jordan, to forge partnership and collaboration among women leaders to encourage, support, and champion one another. At the She Center, we believe that we have a role to play in addressing and redressing the impact of cancer on women globally. Through today's discussion, we hope to galvanize colleagues and organizations so that we can proactively and effectively address the burden of cancer globally and also in the Middle East and North Africa. To this end, we have provided this forum so that we can begin by asking questions, by sharing ideas and inducing productive discussion to promote the awareness and activism and mentorship that is needed on behalf of our communities and women globally. And this way we can change climates. The She team and I are truly privileged to be in the beautiful Amman, Jordan, and in presence of you, Princess Talal of Hashemite Kingdom of Jordan. I like saying that, or Hashemite Kingdom of Ordon, as we say.
Hashemite Kingdom of Jordan. I love saying that too.
I love. Thank you for your time.
Thank
you
so
for
much.
your leadership. Thank you for your mentorship of especially young women, which I have had the privilege of meeting in the last few hours. I'm grateful to you for hosting us here. And to our audience, as we always say, stay engaged, stay interested, and stay tuned for our next Tea Time with She. Thank you.